Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and February is American Heart Month. So today we're sitting down with a Lowcountry cardiologist to learn the signs, symptoms, and treatment options for those suffering from a disease that is the leading cause of death in men and women in the United States, killing 1 out of 4 people each and every year.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Min Tran. He's a cardiologist here at East Cooper Medical Center. Thank you so much for having us today.
Yes, ma'am.
Okay, so we're talking about Heart Month, but before we get into that, let's talk about you. How'd you get here?
So I am from Raleigh, North Carolina, and I went to school at UNC, and then I went to med school, DO school in Virginia Tech. Then I came back to North Carolina to train for my cardiology training, and then now I'm here.
So why'd you choose here?
Charleston is a great area. I mean, it's a great city with multiple beaches nearby, and I'm a beach guy, so I always want to live somewhere that has beaches nearby. So this is a perfect city.
And
not
East
too big.
It's such a great place to work.
Yes, it is, and it's a great staff here. The administration is very supportive of their staff and physicians. So yeah, I'm happy to be here.
All right. Well, let's talk about Heart Month. What are some of the most common heart diseases that we need to know about?
So the most common, heart disease that we see is, what's called coronary artery disease. Basically, that means blockages in the blood vessels around the heart, and that can lead to heart attacks. And then the other thing that we see most commonly is also congestive heart failure, where you have, a weak heart or a stiff heart that can cause you to have fluid buildup in your lungs and your body, and that can cause symptoms of shortness of breath and swelling. And so so there's a lot of risk factors that are associated with heart disease, mainly smoking, diabetes, high blood pressure, old age. Unfortunately, that's sometimes is a big factor, and then cholesterol problems.
So do you see it at all with younger people, or is that becoming
Yeah,
an issue?
Unfortunately, we are definitely seeing more young people with heart disease due to the unhealthy diet and unhealthy lifestyle that this country is experiencing. We are having an epidemic of obesity in this country, and that's something we definitely need to address as a society, is to decrease our rate of obesity in the country.
Well, and Heart Month obviously is all about educating people, building awareness. What are some of the ways that you educate your patients when they come in here? Because you can turn things around, right?
Yeah.
I mean,
for sure.
Those young people, they don't have to live that life. You can help them get right on track.
Yeah,
right?
and so we recommend definitely a healthy lifestyle with diet, exercise, mainly. So we've been it's been proven that a diet of consistent of a Mediterranean lifestyle or diet is helpful to decrease risk of heart disease. And then regular exercise, consistent of moderate intensity exercise of at least 150 minutes a week, is also necessary for prevention or of heart disease as well.
How many is that a day?
That's like 30 minutes a day. 30 minutes a day for about
so
5 days a week.
We're still at 30 minutes a day. I didn't know if it went up, and I didn't get that memo.
Well, I mean, ideally you should get about 300, but at least 150 a week.
He's like, I actually get 1,000.
I don't have time for that, but I try to go for about at least 150 or to 300.
Well, let's talk about some of the different procedures. I always find that East Cooper is always cutting edge, right?
Yeah, so we do the majority of cardiac testing here to diagnose heart disease. We do echocardiogram, which is an ultrasound of the heart. We do nuclear stress tests here. We also do diagnostic heart caths, where we go in with a catheter to look for blockages around the heart. And then we also do measurements of blood pressures inside the lungs and the heart with another heart cath procedure called right heart cath. And then we also do cardioversion, which is a procedure we do for atrial fibrillation, was a heart rhythm problem. And so yeah, we do a lot of cardiac procedures here.
Huh?
Yes, ma'am.
And so what are some of the signs though that maybe I might have, because I always get freaked out about heart disease and stuff. I'm like, is my heart beating too fast? Does that even matter?
Yeah, I
Is
mean,
it
like,
supposed to be like under 90 or something, like your resting?
so resting heart rate should definitely be less than 100
Yeah.
most of the time, and ideally in the 70s.
Gotcha.
And so if your resting heart rate, is consistent at 90s, 100s, that's really not, that's a sign of, of you not being healthy.
Or could it be hyperactivity?
Possible. If you take medication for, for like
Bouncing off the wall.
ADHD or something
Yeah.
like that can definitely lead to,
Yeah.
increased resting heart rate.
Mm-hmm.
And so, yeah, that's going to be a factor. But a lot of times, we see patients, just resting heart rate in the 90s and low 100s, and that's just not a good sign, because that's a sign of them not being really healthy or
So be
conditioned.
mindful of that, right?
Yes.
And then, like, I know obviously your weight and things like that, but are there any other things that, like, if you feel your heart racing, is that normal, or like,
Yeah, I mean, if you feel your heart racing, like a lot, multiple times a week, or daily, and you definitely should seek medical attention.
Because can that be anxiety that's like causing you to get
It
stressed?
can. Yes, it
Okay.
can. Anxiety can be a big factor, and heart symptoms. But we definitely need to get checked out first. We always say, oh, it's all anxiety related. Yeah, because I mean, it's better to be safe than sorry.
So
yeah.
y'all probably turn into therapists sometimes too, They
Well,
come in here, they're like, I'm really stressed, my heart's racing. You're like, it's gonna be okay.
Yes, I mean, I think half our job is to provide reassurance for patients. I mean, I think it's very important to get reassurance for a lot of patients.
And get all the information you need, right?
Yes,
to make
exactly.
healthy choices.
Yes, ma'am.
Alrighty, well, thank you so much for having us.
Yeah, thank you.
And for more information, you can head online to eastcoopermedctr.com.